I'm Karen. Welcome to Park Dental Care. Today's topic I want to discuss with you is why we probe around your gums. And as a hygienist, this is my main focus. So initially, I'd look at the overall appearance of the gums. I'd be looking for any inflammation. I'll also have a look to see if you've got any build-up on the teeth, so some plaque or some tartar, which is the hardened deposit that you get, or any staining, and we'll take some notes down and record that accurately for you. I'll take a special probe, a very basic examination around each tooth, and this will help me feel the texture of the gums, but also enable me to detect what's going on there. This shows you the probe. It's specially designed, these little black bands. This is a very quick way we can assess what's going on with your gums. The mouth is essentially divided into 6 areas, and I will give a score, the highest score, to each area. So I've got a little chart here. Initially, I'll walk around each area. If you hear me shout 0, that's pretty good. You'll have no build-up of tartar. It's perfect health. The probe in healthy gums should only go down probably about 0.5 millimetre. Moving along, you'll see this is a score of 1. I'll record this if your gums start to bleed. And again, we haven't got any tartar. There's obviously some early inflammation starting. Moving on here to number 2. You may or may not get some bleeding, but there is some tartar building up either above and or below the gums. As we go along to number 3, you'll see here the black band is just starting to disappear. Now this band is recorded at between 3.5 millimetres and 5.5 millimetres. So once that starts to disappear, start seeing signs of a bit of bone loss. Maybe a little bit of pocketing start to develop. Now pocketing is when the gums start to loosen away from the teeth. The barrier is basically being broken down by any bacteria that gets in, and you can see there's a little bit of bone loss. And as we go along to number 4, this whole of that black band starts to disappear. So then we start using terms like gum disease, and it starts to show some significant bone loss here. These are the areas that we really need to focus on, and we'll probably do a little bit more detailed recordings. This will help us determine what we need to do for you. If you get a 0, just a bit of advice, you keep doing what you're doing. Number 1, I'll give you some advice because you're clearly missing some plaque regularly, enough that it's causing a bit of inflammation. Number 2, when we start to get tartar, then I'll have to remove that for you because it's too stubborn to remove with your brush. And when we start getting into 3s and 4s, we need to do a little bit more detailed, intensive work. And then we'd get you back in several months' time then just to monitor it, re-record it, and take it from there. Hope this answers some of your questions. Thanks for now.